Hello everyone. Today we are going to discuss about antenatal assessment. Antenatal assessment is very much important to determine the position, the presentation of the fetus in the uterus, its relationship with the maternal pelvis, the fetal growth, and also the gestational age. For this procedure, we require fetoscope or a stethoscope, a measuring tape or a pelvimeter. Now let's move on to the procedure. So before we start the procedure, identify the patient and provide adequate privacy. Also instruct her to empty her bladder prior to the procedure. Antenatal assessment encompasses of inspection, auscultation and palpation. Now let's see onto this. For inspection, place a pillow under the mother's head in order to make her abdominal muscles relax. Inspect for certain scars, abdominal separation, linea nigra, stria gravida. See the contour of the abdomen. See the condition of the umbilicus, whether it inverted or protruded, and see the state of skin if there is any presence of rashes or any other erythemas. Now it's time to measure the fundal height. Let's see how to do it. In order to determine the fundal height, use the ulnar side of your palm. Place the 0th level of the inch tape on the superior portion of the symphysis pubis. In order to measure the fundal height, first of all locate the fundus using the ulnar region of your palm. Now stretch the tape up to the level of fundus, that is your fundal height. Number of centimeters measured is approximately equal to the number of weeks of gestation. At 12th week of gestation, the fundal height will be at the level of symphysis pubis. By the 16th week, it will be midway between the symphysis pubis and your umbilicus. And fundal height will be between your sigmoid process and your umbilicus at 32 weeks of gestation. At 36 weeks of gestation, the fundal height will be up to your sigmoid process. And if lightening occurs at 40th weeks of gestation, what happens is the fundal height reduces 1 or 2 fingers below the sigmoid process. Now it's time to measure the abdominal girth. In order to measure the abdominal girth, encircle women's abdomen using a measuring tape at the level of umbilicus. Measurement of more than 100 cm is abnormal at any week of gestation. Now let's move on to the second, the abdominal palpation. It's also known as Leopolds maneuver. In order to perform the abdominal palpation, instruct the mother to relax by breathing and also ask her to flex her knees. Before palpation, make sure that your hands are clean enough and warm. For the purpose of palpation, use the flat surface of your fingers, not the fingertips. Leopolds maneuver encompasses of 4 different maneuver types. The first one is fundal palpation, second is a lateral palpation, and the third pelvic grip, and the fourth maneuver is pelvic palpation. Now let's perform the first maneuver, that is fundal palpation. In order to perform the fundal palpation, first of all you have to locate the fundus using the ulnar portion of your palm. Place the hands over the fundus and curve the fingers around the uterus. Palpate for the size, shape and consistency of the fetal body part. If the head region is palpated over the fundus, on observation we can find it to be hard and round shape. If on palpation, if it is irregular, bulky or if not well defined, it is said to be the buttocks region of the fetus. And if neither of the above are seen, it says that the baby lies on a transverse position. Now let's move on to the second maneuver, that is the lateral palpation. In order to perform lateral palpation, place the hand on both the sides of the uterus between the midway of your symphysis pubis and the fundus. Apply pressure with one hand against the uterus, pushing the fetus to the other side. By the time the other hand over the other side should stabilize it. Now repeat the procedure on the opposite side of the abdomen. On palpating, if you observe convex, continuously smooth and resistant mass, it indicates a fetal back. Now let's move on to the third maneuver, that is the pelvic grip. For this maneuver, make sure the mother bends her knee. Grasp the lower portion of the abdomen immediately at the symphysis pubis using your thumb and your middle finger. On observation, if the fetal head is above the brim, it will be readily movable. If not, it means the fetal head is engaged within the pelvis. Now let's move on to the fourth maneuver, that is the pelvic palpation. Now place both the hands on both the side of your uterus below the umbilicus. Let your fingers direct towards symphysis. Now press deeply with your fingertips to the lower, directing towards your lower abdomen. Move them towards a pelvic inlet. Now, if the hand converge around the preceding parts, it denotes that baby's head is not engaged within the pelvis. And if the hands diverge away from the preceding part, it means the fetal head is engaged within the pelvic cavity. This fourth maneuver, that is the pelvic palpation, helps to determine the level of engagement. Now, let's move on to the final step, that is the auscultation. For that, place the fetoscope or stethoscope over the convex portion of the fetus, closer to the anterior wall. Fetal heart sounds are heard over the fetal back, which is the scapular part of the fetus, in the vertex as well as in the breech presentation. Whereas in the face presentation, the heart rate is heard over the chest region. Inform the mother regarding the findings and make her feel comfortable. Replace the articles and perform hand wash. Thank you.